I mentioned if you go to the website, there's every page has a spot to email me. I get emails all day, all night long, and here's one that just came in. It says shoulder. So let's see what the person says. My orthopedic doctor took x-rays and suggested cortisone or shoulder replacement. Jeez. I play racquetball and have pretty good pain. Seems like in one spot after that. Well, that's no reason to get a shoulder replacement. Let's start right there. Then they say wearing shoulder support brace seems to help. The x-ray shows a bone spur at the lower side of my humerus into the socket. Just looking at options at this point, wondering if stem cells or platelets can help me. I would say categorically the answer is yes, even without examining this patient. The reason is they have some range of motion. They're playing racquetball, and I'm getting feedback, Alex, just so you know. And wearing a brace helps. That means they're not in dire straits. They can move the arm. My goodness, if you can play racquetball, you don't need a shoulder replacement. That's about as nasty as any surgery can be. I've seen cases where the prosthesis doesn't fit. I've seen cases where the humerus bone a prosthesis no longer fits into the glenoid, which is the joint. The person has no range of motion after that. I've seen cases with infection and terrible things happening. So I am against surgery. I have to put that out there so you know who I am. I've been doing regenerative medicine for my entire medical career. I learned it when I was at UCLA. And I learned it because it worked on my body. I had shoulder pain from a weightlifting injury, and I injected myself as an experiment, and overnight the pain completely went away and the range of motion came back. I was in perfect shape doing all kinds of sports for the next 12 years until I re-injured it, and then it took 2 injections to heal it up. So these things can heal quickly, or sometimes it can take a long time. My most recent injury was about, I'm trying to remember, 3 or 4 years ago with my shoulder. Repetitive golf, and it started hurting. I kept playing, kept hitting, kept practicing, and then finally my shoulder locked up. That one took more treatments than the first 2 times. Right now my shoulder is perfect. I will go play golf today at Pelican Hill, if any of you know where that is. And I can hit the ball pretty hard. I can do all sports. My shoulder does not limit me. And it is an area of concern because that's my sports shoulder. So I've also healed my elbows, my knees, and I've had other people inject my neck and back, all with amazing success. I am in great shape. I can lift weights, I can run, whatever I want to do, I can do. And I've had periods of time before I knew about regenerative medicine using PRP, stem cells and other things, that I was pretty much laid up from sports. And then I was very fortunate to be at a medical workshop in Las Vegas, and my wrist was injured at that time. And one of the doctors there was teaching how to inject wrists. And I told him my wrist hurt, and he injected my wrist, and it was 50% better the next day, which he told me it would be. And then I injected it myself a few times, and my wrist has not bothered me in many, many, many years. I can do whatever I want with it. So I implore you, if that's the right word, Nita, to consider doing this before you consider getting a surgery. Most of the surgeries I see happen are failures, and then the people have to come to me to get regenerative medicine using platelets from their blood or stem cells, and that often will heal them up. Most of the time it does. We have a research department of about 25 people. If you come into the office, you will be in a research protocol, and we follow every patient, and we have, I don't know how many thousands of patients who are in research studies at this point, and the results are amazing. You can always call the office if you want to talk to Brent Shaw, our Director of Research, and the number to our office is 800-300-9300. I'll repeat that, 800 800-300-9300. You can talk to Brent, and he'll give you all the statistics on your chances of healing up. So, yeah, don't consider surgery if you can get an injection and walk out. Does it make sense to get surgery? Not to me. I've had one surgery on my shoulder, and it turned out as an abomination. So after the surgery, I learned about doing this regenerative medicine work, and that's what I've been doing ever since, because it healed me overnight. So these surgeries can have terrible side effects. Don't kid yourself. I know we all think that surgery is the answer, and I know that that's what orthopedic surgeons do for the most part. They're starting to get smarter and starting to do regenerative medicine now. God bless you guys. And this is not a diss of orthopedic surgeons. We need them. That's the hardest work in medicine. It's dangerous work for the patient. There's a lot of sequelae after things, that side effects that we didn't expect. And you all know people that have had surgeries, and we know there are diagnoses like failed back syndrome that the insurance companies use. That means that you had a back surgery and it failed. So what does that mean? It means there's so many people that have failed surgeries that the insurance companies have to make up a diagnosis for it. That's a sad thing. There shouldn't be a diagnosis of a failed surgery. If these surgeries are good, we wouldn't have those diagnoses.
Our number is 866-870-5752. Again, that's 866-870-5752. Give us a call right now. All the lines are open just for you. 866-870-5752. And check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. I bet you have another email waiting, don't you?
Well, I do. I have thousands.
I know. That's why I say it that way.
I'd like to just mention the vampire facelift. It's a non-surgical procedure where we inject the face with your platelets or stem cells, and it regrows the collagen in the face and makes people's faces look younger overnight. So that's a great thing to consider also. We also use these modalities on the head to grow hair. So if you're thinning, male or female, it doesn't matter. We treat both. And these are great, great things. Staying away from the knife is something that I have taught for the last 20 years at UCLA. And the idea is simple. Stay away from surgery if you can. Let's do these things by regenerating tissue. So this one, this email says, back pain. This just came in. And while I'm on the radio, I actually watch emails coming in, which is interesting. This person says, I've been living with multi-level disc degeneration for a number of years since the results of an MRI scan. So let me just deal with that one sentence. Degenerative disc disease does not cause pain. And just because someone sees something on an MRI does not mean that's where pain is coming from. All right? I know that doctors jump to an MRI to find out what they can cut. That's not good medicine. I'm sorry. Good medicine is using your hands and doing an examination to find out where pain is coming from. Most people that come in ready for a surgery do not get a surgery from me. They end up getting regenerative medicine. They end up getting some shots. And the shots are cells from their body, platelets or stem cells that regenerate the tissue, that regrow the tissue. Why am I going to cut tissue out? That destabilizes there and makes it worse. Once someone has a surgery, it's a setup for another surgery. People that come that have 3 or 4 surgeries and they're ready for another one, they go, I'm sick of the surgeries. They didn't work and I keep getting worse. What can I do? And we can often heal them up, even after failed surgeries, by just injections. Wouldn't you rather have an injection? It's easy. You get an injection, you walk out and go about your business. At any rate, don't believe your MRI. No, I'm not saying that this person doesn't have degenerated discs. I'm saying that most people as they age have degenerated discs and don't have back pain. So don't think because your MRI shows something that means where your pain is coming from. Please, please, please stay away from the surgeries if you don't need them. This person goes on to say, I'm only 35 and was very sporty, but am now restricted in my movement so much due to fear of another episode of chronic back. It is a daily struggle with some days better than others. Once again, aggravate the discs affected. Now, this person's making assumptions. This probably has nothing to do with the discs. It's probably the ligaments, which are easy to regrow the connection from the ligament to the bones. And we call that an enthesopathy. If you look up enthesis, you'll see that's where the ligaments, tendons, or muscle attaches to bone. And that is where most pain arises from in the back. Let's see, what else did they say? Also have a fissure in one disc that creates shooting pains. Now, how does this person think that they know that that's what's going on? Because an MRI shows it? Nah, not true. Sorry. And then the person says, I would be very interested in orthokine, regenikine treatment. Please help me. So let me just tell you what orthokine and regenikine are. Number one, they're illegal in this country. They're done in Germany. They're very expensive. I hear of guys here charging, $20,000 for it. And number one, again, it's illegal. All it is an anti-inflammatory. Yes, it gets rid of pain. But if you get rid of pain and you still have the problem, what do you think happens to you long term? The problem gets worse. Orthokine and regenikine do not grow back tissue. They're strong anti-inflammatories. Don't do it. Maybe if you're 100 years old and you're not going to be walking around, consider it. But if you're an active person, don't do it. That's just my 2 cents. You want to go do it, you find a doctor that does it, go do it. I'm not gonna call up the FDA and have that doctor shut down. That's their business. And if they think they're doing good, God bless them.
Okay, well, we do have Judy waiting from Canoga Park.
Judy. Hello, Judy. There you go.
Good morning.
Judy, can you hear me?
Yes.
Yeah, can you hear me?
Yes. Can you hear me?
I hear you very well now. Thank you so much.
Okay.
So you have a shoulder problem and your son has a knee problem. So what I want to do, I want to first go to your son's knee problem. How long has he had it for?
He's had it for about 5 years, and he has bone on bone. Is there anything you can do?
Yeah, I just splurted out. No, he doesn't have bone on bone.
Okay.
Is he walking?
He's walking.
Does he walk?
But his right knee.
Wait. I got questions. Questions first.
Okay.
How old is he?
54.
I didn't catch that. He's what?
54.
54. Okay. And can he bend his knee?
Yes.
Does he do any sports?
No.
Okay. How far can he walk?
He can walk like 3 miles.
Okay. So let me say this again. I want everybody listening to hear this. It's really important. Your son does not have bone on bone. That's a phrase that surgeons throw out so they can do a knee replacement or do a surgery.
Oh.
God bless those surgeons. But they're not helping people by implanting fear inside of them. And bone on bone means that bone, that joint can't move. Because if it's bone on bone, there's no cartilage and you cannot move that joint. You cannot walk 3 miles if you have bone on bone. Do you understand what I'm saying?
Yes, I do.
Good. I want everybody to get that. We get so many people that call in or people that send me emails or patients that come in literally crying, saying, I have bone on bone. I've been to 3 surgeons and I have bone on bone. I need a knee surgery or shoulder surgery replacement. And I move them around and I start laughing. I go, you got a good joint. Your joint's fine. You just need to regenerate a little tissue inside of it.
Okay.
And we get them better usually.
Okay, when he walks, his right knee goes in.
I understand, but he needs to get an evaluation by a regenerative medicine doctor, okay? Not a chiropractor that's selling a procedure they don't even do.
Okay.
I'm against that.
Okay.
This is something that should be done by a medical doctor who does it all day long, not a guy who gets hired by a chiropractor to come in, every once in a while to knock out a bunch of his patients when the guy doesn't even know how to do it.
Well, we're going to have to make an appointment to get evaluated. Thank you, doctor. So what would be the protocol?
I'm not done. I'm not done with you yet.
Oh, okay.
So first of all, the phone number to the office is 800-300-9300. I'll repeat it for you so you can write it down. It's 800-300-9300. You can also go to my website, which is www.lastemcells.com. And on the website, you'll see videos of me injecting many different parts of the body, and see if it's something that you think you would like or your son would like.
That sounds wonderful. That sounds so hopeful.
I know that you mentioned that your shoulder bothers you. How long has it bothered you for, Judy?
I had a shoulder replacement due to an accident 4 years ago. Now, my orthopedic doctor said that I would do very well with I cannot move my shoulder, but he said he could do the surgery, but he would rather me go to a very well-renowned doctor to get a shoulder replacement. And I am just terrified because I hear people saying that it works and other people say it doesn't work. So I am...
Well, let me ask you this. Do you like to go to Las Vegas?
Yes, I do.
Okay, so you're a gambler, right?
Yes. But I'm not.
It's like going to Las Vegas when you get a... Okay, that's a good point. But when you get a surgery for orthopedics, you are gambling. Some come out amazing and some come out terrible. And I never was board certified in orthopedic surgery. I'm a physiatrist that I'm board certified in through my studies at UCLA. Mm-hmm. But the reason I didn't go the orthopedic route is because I've seen people right in front of me die on the table. And in my mind, it was for surgeries they never needed to begin with. So I am not a proponent of surgery. I love the surgeons, though, because sometimes it's needed. Now, I got confused. Hang on with me, and we'll catch you after the break. Okay, Judy?
Stay with us, Judy.
Thank you so much for
You're
calling.
listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information about to come your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.